Mr. Speaker, my question is for the Minister of Health and Wellness. As the Minister knows, there are a great many patients in our province's hospitals, often referred to as alternate level of care patients, who are waiting for long-term placement. And often these are older people. Many of them have been in hospital for a matter of months. But what people are often less aware of is that group of patients, unlike other patients in our hospitals, pay a considerable daily fee for their hospital stay. In fact, pay the full nursing home rate, often in an average of about $1,000 a month. In other words, they're paying nursing home rates, but they're not receiving full nursing home services.
Question, please.
Does the minister think this is a policy that can be defended?
The Honourable Minister of Health and Wellness.
So I thank the member for the question. So certainly those folks who are in hospital waiting for nursing home placement are considered to be an alternate level of care. And there's been a long-standing policy in this province where at that time those patients are charged the fee that they would be charged when they go into long-term care, because essentially that is the care that they are receiving. So there is there's no undertaking at this period of time for us to review that policy.
The Honourable Member for Halifax-Shabukdale.
The contention I'm trying to make is that it is not the level of care they're receiving. And I'm thinking particularly about an area like recreation. For example, our hospital patients in Nova Scotia, unlike nursing home residents, don't even have access to TV unless they pay for it by renting a TV weekly at about $100 a week from the hospital, and they often don't have that money because they're paying out so much in the nursing home fee. And our provincial government is taking in nearly $5 million a year from people who are in this situation. Does the minister think it's fair that the government is taking in $5 million a year from fees from people in hospital waiting for long-term care who don't even get so much of the services of long-term care as being able to watch TV?
The Honourable Minister of Health and Wellness.
Thank you, Mr. Speaker. I thank the member for the question. So certainly in the alternative level of care units that are in the hospital, I know that hospital staff do have some supports in terms of recreation. I think what the member really speaks to is the necessity of us to have a transition to care units across this province so that we can create environments where folks are cared for with the correct skill mix, and we do have a variety of different individuals to look after them. So this is a pre-existing policy. We certainly recognize that the hospital is not the best place for people who are waiting for long-term care to be, and we want to make sure that these transition to care community facilities will support our seniors. Thank you.